Carrie. Hey, Christy Athens. Shantae, good to see you. Andy. Looks like Hannah might be here. Looks like we've got a good amount of folks here. So we're going to go ahead and start off because we have a pretty full agenda today. We're going to hear from Kaylee and Sarah about the HRSN 1115 waiver. I don't know what the fast way to say it is. We're going to hear from 10 Rivers Food Web, and we're also going to hear some updates about the Regional Food Business Center. So Kaylee, if you want to introduce yourself, and I think Sarah, and take it away.
Yeah, absolutely. Thank you, Sydney. Thank you, everybody, for having me today. My name is Kaylee Summers. I use she, her pronouns, and I currently work at OHSU as the Food Security Program Manager, focused on employee resources for employees at OHSU, so internally looking. But I also wear the hat of the OCFSN VeggieRx Working Group Coordinator. And have in past jobs managed veggie prescription program at an organization called Adelante Mujeres in Washington County, and have been kind of convening these learning spaces for produce prescription or veggie prescription programs and food access programming across the state. So this is something that, and talking about, we usually call it the 1115 waiver, but 11115, yeah, maybe it's a little, takes a little bit more time to say, but 1115 waiver through 1115 demonstration Medicaid waiver. I'll be talking a little bit about that today. I am by no means an expert, but have kind of plunged into the deep waters of the Medicaid world to try and figure this out, because there are some funding streams for food and nutrition benefits that this group may be interested in learning more about. And Sarah, by all means, like Sharon, I didn't really talk too much about this ahead of time, but feel free to introduce yourself and interject at any point and share your experiences with all of this too.
Yeah, I'll do a quick intro. Thank you, Kaylee and Sydney. I'm Sarah Sullivan. I'm the Executive Director of Gorge Grown Food Network out here in the Columbia River Gorge. We've been running a VeggieRx prescription for, goodness, probably 7 years now. And yeah, just been exploring the whole Medicaid funding stream for many years, and really excited that some of it is coming down the pipeline finally. So Kaylee is an expert, and I'm going to kind of defer to her, but yeah, part of our goal is to sort of translate some of this really complicated like healthcare language for folks working on the ground, in hopes that you may be able to partner to get more local food out to people that really need it. So
Thanks, Sarah. Okay, so what I figured for today is we could start with some basics. And I think what I see as success is if you walk away knowing at least one more thing about the 1115 waiver that you didn't know before. But I want to kind of see where we're at right now. So if folks could use like the raise hand button or like emoji thumbs up button, or like head nodding if you know the difference between Medicaid and Medicare. Okay, see some shaky, like, could you unmute yourself and say, here's a definition between the two? Not to put I won't put anybody on the spot. Anyone want to take a stab at it?
I'll try.
Oh, great. Thanks, Teva.
I think that Medicaid is specifically for like low income, and then Medicare is for elderly, correct? And like retired folks, because like aid is associated with like families and anyone, and then care we like associate with like elders. That was what I was taught in public health.
Absolutely. Yes. Great job. Thanks for being brave too. That's the words that I usually try to associate for myself too. So aiding families that are maybe financially struggling, and care. I think about, I would want to care for my grandmother in this way, right? There are some other nuances to that too. There are folks that are dual enrolled. There are folks that receive disability support that may be on Medicare, even though they're not, 65 plus. Hannah, yeah, did you want to add to that definition? Or your hand might just be up. Or yeah, go ahead.
Oh, is that me? Yeah, I didn't put my hand up. So I'm just here to listen and learn.
Oh, great. Well, thanks for listening and learning. Yeah, so back to that definition, we've got Medicaid and Medicare, right? Medicaid, the aid for families that are living under the poverty line, are struggling to make ends meet. Medicare for elderly folks. And again, there's folks that also may be dual enrolled, or because of disability status may be enrolled in Medicare as well. So each state, and who here has heard of Obamacare or OHP, Oregon Health Plan, right? Okay, got some hands up. So that is Oregon's version of Medicaid. So folks that are enrolling in OHP that are, or as we used to refer to it as Obamacare, is Oregon's healthcare plan for folks on Medicaid. Each state has their own, what we would call OHP or Oregon Health Plan for each of their states. And at a national level, the Center for Medicaid Services, CMS, dictates what type of benefits and coverage every single Medicaid member receives. So there's kind of these basic coverage benefits that everyone under Medicaid would receive. But each state is also eligible to apply for what we call these 1115 demonstration waivers. So they're kind of like this possibility for each state to say, actually, we want to expand our Medicaid coverage service beyond what the minimum federal basics are. We want to expand that service and we want to try something new. So the state can apply for an 1115, and it's called a demonstration waiver because oftentimes it's trying to pilot or test out if these expanded services will do what they think they want them to do, and impact the populations they're trying to serve in a certain way. And Oregon, this is not the first time that Oregon has applied for 1115 waiver and received it. But this is the first time that Oregon has applied, received it, and specifically named health-related social needs. So thinking about if folks are familiar with social determinants of health, like housing, transportation, food, education, all of these social needs that we have to live healthy, full lives that aren't necessarily our medications or our physical therapies and things that under what we would think of conventional medicine. But still, if we don't have access to all these social needs supports, we wouldn't be able to be healthy, productive folks in our lives. So a lot of states, or a few states, including Oregon, but Oregon, it was pretty monumental that we included these health-related social needs. And actually, I'm going to share my share screen so that you guys have a visual reference of this. And I apologize, this actually isn't a PowerPoint, it's a little PDF, and I'll send this out to you afterwards. But these HRSN, or health-related social needs, what they're including, and I should back up too, there's other parts to this 1115 demonstration waiver that I am not going to try and be an expert in, but they're things like continuous enrollment. So for kiddos, infant through 6 years old, instead of having to re-up to apply for OHP year after year, there's in continuous enrollment in OHP. So things like that I haven't delved into that much, but there are other parts of this demonstration, 1115 demonstration waiver, that are included. And the period of time is 2022 to 2027. for this demonstration waiver. But these HRSN health-related social needs include things like climate support, housing support, nutrition support, outreach and engagement support. And climate support, meaning like it will pay for Medicaid members if they need an air conditioner unit, if they don't have that in their living situation, if they don't have a heater or an air filter, or it also includes things like if someone needs medication to be refrigerated and they don't have access to a refrigerator, then it could pay for like a little mini fridge for that person to have in their home to store their medication so that it's safe and ready for them to use. And then housing support is what it sounds like, housing for folks that are at risk or houseless. And I'll get into a little bit more of the eligibility in a second. And then nutrition supports, I'm going to really dig into because that's around food, nutrition support. And then this outreach engagement support is like letting people know that they're eligible and how do they know about these services. The eligibility. So we talked about Medicaid, Medicare. We've zoomed into Medicaid. Within Medicaid, there is still a smaller population that folks are going to be eligible for these HRSN benefits. So we're talking about folks that are in transition populations. And what they mean by transition populations is this long list here on this right side of youth ages 19 to 26 with special healthcare needs. And that's actually a like coined term within OHA. It's not just like, hey, I've got a 20-year-old daughter who thinks she's got some special healthcare needs, right? There's a specific definition within that. And I don't have all of the specifics there. And the income up to 300% of the federal poverty level. Youth involved in child welfare, including leaving the foster care system at age 18. This also within that, the youth and folks that have been involved in the child welfare system at any point in their life. So this could be a 32-year-old that was in foster care that has exited foster care, is an adult and is on Medicaid, but has been involved in that. So at any point in their life. As I mentioned before, individuals experiencing or at risk for houselessness, older adults transitioning into what we were talking about, that dual coverage, or sometimes they say dual status of Medicaid and Medicare coverage, people released from settings such as jail, prison, residential facilities, or Oregon State Hospital, and individuals at high risk for or health risk during weather-related emergencies. So as we're talking about like the climate support systems there. So we're narrowing this down to transition populations. Someone doesn't need to meet all of those bullet points. It can be just one of those bullet points under these, the eligibility category. Then they also need to have a health condition that would warrant the need for these things. So if they are an individual that is released from prison and they have their diabetes is out of control and they don't have any food to help them through kind of controlling their diabetes, then they would be eligible for this nutrition support under the 1115 waiver. I'm going to pause really quick, see if that brings up any immediate questions for anyone, or Sarah, feel free to jump in too. Okay. Feel like I was told to wait 7 seconds and then feel free. Also, I'm not really monitoring the chat, but feel free to stick questions. Oh, Kayla, yes.
Yeah, I guess just like my first question with the list of things that could possibly make you eligible, but also needing a health condition that like warrants it, like how would an external support organization even know that someone was in the target population, right? I guess is my question.
Yeah, that's a great question. So that outreach and engagement support is going to come into play here. So there are organizations, let's say folks that, or organizations that have community health workers that may be already screening for this kind of, these kinds of demographics, right? So they may already have screener questions related to are you on Medicaid? Or maybe they're signing people up for OHP, right? And they're helping them fill out the application to make that happen. So there's going to be organizations that are kind of doing this outreach and engagement. It might also be healthcare practitioners, a nurse practitioner, a social worker at a hospital that are screening for these things within the medical system itself, and then referring those folks out to receive the HRSN support services, which is most likely going to, well, there's going to be a lot of referral processes, but one of the avenues for identifying who would actually meet this criteria and the eligibility. Does that help answer your question a little bit, Kayla? Okay, cool. Sarah, did you have more to add about that too?
No, I think that you did a good job answering that, Kaylee. I can share once you're further along sort of how what this looks like in the Gorge, which might help community-based organizations understand what's their role and what's not their role. Yeah,
that sounds good. So I'm gonna jump ahead a little bit. I'm gonna jump to the nutrition specific supports, and I'm gonna show you this slide as well to explain what's covered under that. So looking at this again, high level overview, this is right on OHAs, and actually this is the OHA. I'm going to put this in the chat if I can figure out how to do that. Here's a link to the OHA website, and this explains a ton on each of these services. So if at your organization you touch on food and farming, but you're also working in housing or climate supports or outreach, you can click on these and it gives you a little bit more of a rundown of these things. You'll see here, climate supports went live March 2024. So this year, a couple months ago, and their folks are screening and getting those services. Housing is supposed to go live in November 2024 and nutrition January 2025. Outreach engagement is ongoing since March as well. But let me hop back to, oh gosh, of course it's gonna be, sorry y'all, technology. Okay, here we go. We're gonna go here. Okay. Do you see the right screen? It says high level overview of HRSN nutrition. Okay, cool. So under this benefit, what is actually covered? We've got an assessment for medically tailored meals, which just means registered dietitian or nutritionist. Again, this is going to probably happen more on the clinical side of things. So someone goes into an appointment, they screen eligible for this service, then they're going to screen, oh, you would be eligible for medically tailored meals, and what kind of medically tailored meals. And what we mean by this is like folks, maybe they just went in for surgery, and for post-care, their healthcare practitioner is saying, you really, like you're not going to be able to cook for yourself or really prepare nutritious meals that your body really needs to recover from the surgery. So let's do this assessment for medically tailored meals and get you connected with medically tailored meals for that post-surgery recovery. So you can also see medically tailored meals are under this. There's the fruit and vegetable benefit, aka VeggieRx or produce prescription programs, right? So this would also be an eligible service here. Pantry stocking and meals. Pantry stocking means like basically a gift card or something beyond just fruits and vegetables. So other pantry staples that are stocking someone's pantry, and meals that aren't medically tailored meals, but these might be hot food, prepared food, meal kits, restaurant vouchers, things like that. And if you see this little box right here, we narrow down even further because those pantry stocking and meals are only available to another subset of that transition eligible population. And these are folks that are going to be pregnant or newly, have recently given birth under that population here. And then there's a nutrition education piece. So this would include like individual consultation, or if you have group classes that you're doing like cooking classes, or diabetes education cooking classes, different things like that. This would also be a paid service here. All more or less across the board, obviously not the assessment, but everything else could be available for up to 6 months. And depending on funding and the members' reassessment, it could be renewed beyond that 6 months. So let's say, Kaylee Summers, I go into my doctor, I'm eligible, I've got Medicaid, and I have a health condition, and I'm under one of these transition populations, bingo, 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 I am eligible. And my doctor recommends that I need to get more fruits and vegetables. So they're going to sign me up for this fruit and veggie benefit, and I'm going to get that benefit for 6 months. After those 6 months, I could go back to my doctor and they could say, oh, yeah, it looks like you still need this support. They may be able to renew that benefit for me beyond the 6 months. There's still a lot of unknowns, though, in this process, because OHA and the coordinated care organizations who I also didn't, anyone want to raise their hand? And do you know what a coordinated care organization is? Yeah, Kathleen, can you give us a definition?
Yeah, coordinated care organization, or CCO, is a insurance it's an organization that has insurance, but that also has a community advisory councils that work within certain regions to address various health needs depending on that region. All Care is the one down here in Brookings. Advantage Healthcare is another one that's on the coast. I was on one of the CAC councils for 3 years, so.
Awesome, Kathleen. I'm glad you mentioned the community health advisory councils too, because that is an important part of that. And as you said, it's like the insurance companies or organizations that cover Medicaid members in Oregon. So other states call them accountable care organizations, or there's other names, but in Oregon, we call them CCOs, or coordinated care organizations. And we have 16 in Oregon. So they all cover different regions of the state. And All Care is one of them, Pacific Source, Health Share, Eastern Oregon CCO. There's 16 different ones. And like Pacific Source has coverage in different areas. So there's Pacific Source Gorge, Pacific Source Central Oregon, and they're, they cover different regions there. So, oh yes, thanks Sarah for adding the map in. So if you don't know who your CCO, you can look in that map and see within your county who covers. And some of the CCOs cover, like in the Tri-County area, we have Health Share and Trillium. So they overlap each other too. So there's some regions with some overlap there as well. So where did I get off on that, the CCO tangent? Basically, the CCO is the one that is going to confirm eligibility for folks. There's also folks, to just complicate things even more, because we love complicated healthcare systems in the United States. There are folks that have open card OHP, which means that they don't have a CCO that's coordinating their care under Medicaid. They have an open card member as an OHP member. So if those folks are eligible, they can still get these HRSN benefits, but that is going through a third-party approver to like make sure to authorize that benefit to them. Okay, I'm gonna stop here again. Questions, things that this bubbles up for folks? And if not, then I think it's also, this would be a good opportunity, Sarah, if you want to kind of share what's happening in the gorge with these benefits too.
Yeah, so hopefully this helps people kind of picture what this looks like on the ground. So in the Columbia River Gorge, we're covered by Pacific Source, CCO. And so we have been in dialogue with them and a few other main community partners that work with these very specific populations. And so in our region, we're approaching this with what's sort of a hub model. So there will be a couple of main groups, mainly the Mid-Columbia Community Action folks who run like our transitional housing shelter and those kinds of service, like wraparound services for people in housing transition. And then another group called Bridges to Health, and they are community health workers that are already, connecting people in our community with lots of different services. So my colleague and friend here, Kiara Kishuba with Gorge Farmer Collective, we've been a part of these conversations and just figuring out, okay, like we're not healthcare providers, we're not social service providers. How do we receive funding for food to simply get the food to the people? So we're figuring that out. There is a community capacity building grant as part of this program. Unfortunately, the first deadline is coming up hot on Thursday, and but there's another funding opportunity.
Friday, Sarah, it's Friday.
Sorry, Friday. Okay.
You almost gave me a heart attack. Friday.
So for those not ready for that, there will be another grant. They're still deciding kind of end of 2014 or early 2015. So yeah, and basically, I know like many of you, we were kind of panicked at first of this referral process. Like, are we going to be going out into the community, like trying to find these folks that are eligible? No, we'll receive referrals, and then someone like Gorge Farmer Collective gets reimbursed. And if you're just thinking, this is a pilot program, so what? It's over in 2027. We're really hopeful that it will not only continue but expand, and that has happened in other states. So it may seem like a really small, specific part of our community, but of course, it's really important to serve these particular people. But even in a very rural area, like, we have 75,000 people total in the gorge. We're looking at about probably 500 people eligible for the housing supports, just as an example, which might not seem like a lot, but Kaylee will probably share the numbers of how much these reimbursements are. And it really adds up. And so I'm glad it's kind of rolling out slowly so we can figure this out together. But in total for 2 years, the funding is $900 million. Which is enormous. It will go quickly with housing, but I'm really excited that our state is getting on board to like truly fund social determinants of health, which we've been trying on the ground in small pilots, but this is like a really big deal. So Kathleen, you had your hand up.
Yeah, thanks, Sarah. Questions include, who did you approach your CCO or did they approach you? Do you have a particular person or department you approached? Do you have to be a nonprofit to get involved in this, etc.? I'm currently a for-profit food hub, if you will, down in the Southern Oregon coast, but probably going towards nonprofit status before long. And this is exactly the kind of thing I've always wanted to get involved in. So,
yeah. You do not have to be a nonprofit. So a for-profit, I think it's a really amazing opportunity for entrepreneurs who want to make food. And I'll tell you, at least in our region, there's a real lack of capacity and interest to do that so far. And let's see, Kaylee and I can probably direct you to the best person at your CCO. We're a really small community here. So like some of you might remember Lexi Stickle. She's involved with food systems stuff for many years before she became a Pacific Source employee. She and I sit on a steering committee of a food security coalition. So she, we have a close relationship, and I don't know if all CCOs are this way, especially in an urban area, but ours has been really helpful and like very communicative and kind of on call for questions. And they need this to work. They are on the hook to deliver all these services to all of their clients. Any CCO is probably in threat of, losing a contract if they don't deliver well. So they have an incentive. And why I was kind of like shaking Sydney to talk to this group is if this funding doesn't go to local food systems or local entrepreneurs, it will leave our community and likely our state. So the CCOs will have to contract with like big, I don't know, I don't want to name any company names, but you know what I mean, like a Misfits or whatever that Farmbox RX thing is, out of Boston, food from wherever that's making people food insecure somewhere else and shipping food across the country as usual. So let's not do that. And they'll also contract out the meals like to Meals on Wheels or some sort of big national conglomeration like that if we don't step forward. So yeah, Kaylee, maybe sharing the actual numbers on reimbursement would be helpful.
Yeah, and I wanted to address a couple of the questions. So the money, the grant fund for, as Sarah said, 900 million is coming from the National Center for Medicaid Services. So it's federal funding that is granted to OHA, the Oregon Health Authority, and then the community capacity building funds, the ones that we keep referencing are due on Friday, are being administered or distributed through the 16 coordinated care organizations. So OHA is like passing that money through the coordinated care organizations, and the link that I put in there lists all of those coordinated care organizations. And if you click on the little plus sign on those, it shares the email address of the person that's administering the community capacity building funds. And I would suggest that would be a good place to start with if you've never made contact with your CCO partner before in your region, because they're monitoring those email addresses quite regularly now that these funds are due on Friday. So even if you don't intend on applying for those funds on Friday or by Friday, it would be a good point of contact to get in touch with the appropriate person there. And those community capacity building funds, they've been saying that they're going to release another round of that funding at some point, probably next year. So if now is not the time to get all your ducks in the row by the end of this week, but you're interested in looking at this for the future and want to build out some of the capacity of your organization to provide these services, then this is really great funding to do that. And it's not contractual. So if you receive the CCBF funds and you decide at the end of that process that you're like not equipped to be a health-related social needs HRSN provider, you're not contractually obligated to like provide those services after that community capacity building funds. Did we get, okay, and sorry, so you apply through your local CCO, you don't apply through CMS or the Center for Medicaid Services. Yeah, so all of this money is getting funneled through directly to Oregon and then the CCBF funds. So that's just for capacity building. If you're wanting to become an HRSN provider, and I'll go through the reimbursement rates that have been proposed, but they're not set in stone yet. Again, OHA is trying to fly this plane without it fully being built yet. And okay, so but this is a reimbursement benefit. So you would provide, let's say, the fruit and veggie prescription box or medically tailored meals, and then you would invoice and get reimbursed for that service. The community capacity building funds are just simply for your organization to build that capacity that you would need in order to start providing those services. Does that help clarify kind of those two streams of funding? And the community capacity building funds are not to fund food. Like they're not to start launching a program right now. It's just like, okay, how do we figure out our workflow, our financial and administrative processes, our staffing capacity, our HIPAA compliance, our technology platforms that we're using, whatever that might look like that you need to build within your organization to even start to provide these services. So, okay.
At least where we are too, Kaylee, that could also include like food delivery or freezers, some infrastructure within reason.
You can't buy a building though.
You can't buy a building, unfortunately.
Can't buy a building. That's not an eligible expense. Okay, so let me pop up the proposed fee schedule for these things here. Where did that go? Okay, so apparently OHA hired a consultant, as they do, and hopefully this is a very large project, and I totally understand that there are a lot of unknowns. It's huge overhaul system, like there's a lot of things going on. So it makes sense that there's a lot of unknowns. It's just, I make these little comments sometimes because it feels like, what are you asking us to do? And we don't have all the details to do it. And how are we supposed to do? Yeah. Anyways, so they hired a consultant. They did research on other programs that are offered or similar programs across the country in different states with different income levels and prices for items. And this is what they came up with. So medically tailored meals, this would be $10 per meal. And that includes everything, like the food, the staff time to prepare that meal, the container that it is held in, the transportation to deliver it to someone's home. It includes everything. Medically tailored assessment. So this would be like if there's a nutritionist or dietitian that someone's doing, getting an assessment with, that it would be billed at $25 per 15 minutes. So if that visit took 30 minutes, then they could bill for $50 for that. Pantry stocking would be $65 per week per person. So most of these, like the medically tailored meals, this would be for an individual patient in that eligible population. It wouldn't be that they get a meal and everyone in their household gets a meal as well. It's just for that patient. But the pantry stocking would be, there's an eligible person, but then their whole household or family members within that whole household would be covered under that. So if it's an individual, it would be $65 per week. But if it was a family of 4, multiply by 4 for that. And then regular meals, like not medically tailored meals, would be $9 per meal. The fruit and vegetable benefit would be $16.80 per week per person. Again, like the pantry stocking, that would be dependent on the number of people in the household. So if it's 4 people, again, multiply by 4 there. And then the nutrition education, $12.50 per 15 minutes. So if it was an hour-long class, you could bill 12 times for that class. Again, this is all reimbursement. So your organization or your business would have to have that cash flow up front to be able to cover that. And then you would invoice and you would get reimbursed for those meals or for the pantry stocking or whatever it might look like. Yeah, Hannah.
Hi, now I have a question.
Yeah.
So for the nutrition education service, for example, would the audience, like for a cooking class, would the audience have to be exclusively people who meet the HRSN eligibility, or would it have to be like a certain percentage of attendance? How would that work?
I don't believe so, not from what I've heard. So for group education classes, like if you're doing a seed to supper class or, whatever your curriculum looks like, you could have 10 people in your class and 1 or 2 of them might be in that transition population and eligible for this service. So you would bill for them individually. You would say, Scott is part of this class and was approved to be a part of this class under these eligibility guidelines, and I'm going to bill for this amount for an hour-long class. But you wouldn't necessarily need, you wouldn't have to have everybody in that class part of that transition population, if that makes sense.
Yeah, that makes sense. Thank you.
Yeah, certainly. I do want to say, so these were the proposed rates. There were several organizations that, including Gorge Grown Food Network and OCFSN, that we submitted feedback and suggestions on increasing these rates based on the cost that we see as reasonable, especially looking at local foods. And I do want to point out that, OHA and all of the application materials, they're asking for our organizations culturally and linguistically responsive to the communities that they serve. And I think that there is a interest and need, obviously, to really bring in this health equity lens and thinking about the population that is really targeted for these services. And as OCFSN and through the VeggieRx working group, we've really said the organizations that are BIPOC-led, that are investing in local food farmers, this is in response to what their community wants, right? And if we really want to create a culturally and linguistically and community center approach to this work and to these benefits, we really need to have that reflected in the reimbursement rates that are being offered. Now, there's no guarantee that they will increase that, at least in this rendition or this, 1115 waiver. But I think to Sarah's point before, it's really important that we do get involved to voice those concerns and voice those suggestions so that in future rounds of funding or future expansion of these services, that we have a strong voice to say, this is what our communities are asking for and what we really want to invest this federal money into. Yeah, I've totally lost track of the chat. So Sarah, are you keeping track of that? Okay.
Yeah, I would just add that, yes, a lot of people are advocating for more funding for all of these things. Something else to think about that we've learned from other states that are really succeeding is the braided funding idea. So this may not cover the entire cost of what folks really need, but it really helps with a portion of it, right? So I'm really interested in looking at other, especially funding from healthcare, but this amount of money will just really make it easier for those of us that are fundraising to get a match. And that may even be like through the CCOs. Like, for example, Pacific Source right now is providing funding for VeggieRx through something called Flex Services or Flex Benefit Funding. It's for, again, social determinants of health, things that are not like healthcare, but that keep people healthy, like air conditioners and food. And the funding is available. So what we might be able to do is like increase the dollar amount for an individual to make sure that the box they're getting weekly from Gorge Farmers Collective is robust and enough for several meals, or extend the 6-month prescription to year round, and just make it more continuity in people's lives, because I'm sure those of you that have run VeggieRx programs or been involved, it's really hard to pull people's food access, especially as winter is coming and lots of people are out of seasonal work. So that's something we're really trying to avoid. So yeah, if anyone's interested, I mean, I'll put some other links in the chat of this braided funding models in other states that are really working. And just from like an organizer's point of view, Gorge Grown ran VeggieRx programs for many years, with many staff, including Kiara here, who was on our team for a long time, packing radishes into boxes, you know, during the pandemic and everything else in between. And I'm so psyched that Gorge Farmers Collective is going to be taking the lead on the actual food aggregation and delivery now across all of our programs. So just another like good way for a nonprofit to step back, let that funding go to the actual farmers. And then I can work on finding funding to like extend that program. So I'm really psyched about that.
I do have a quick question. I want to say to Sarah, hopefully, Sarah, you were talking about a month or two away, that the winter is coming and not 2 or 3 weeks from now. Because I'm looking for summer. It just hadn't gotten here yet. But I'd like to know kind of what is the breakdown of the financial contributions to the federal, the state, the OCC, if I'm saying that correct, and even private industry. What is the breakdown so we can know the fluctuations of if there's not funding available from the feds or from the state? Is it offset with some other resource streams or what? But just kind of how that works.
I think we're kind of piecing that together. I can tell you that out here in the Columbia Gorge, our CCO has been very transparent that what they have for this round of funding for the capacity building grant, that's for the staff or delivery or boxes, and housing support, is about $880,000, which is not enough when our friends over at, you know, the Annex Transitional Housing are also trying to staff up. I imagine it's much, much, much larger in the urban areas. And then for the actual food, housing, and climate supports, the 1115 waiver funding is $900 million for 2 years. And beyond that, I think we have to kind of shake the trees, and figure out how do we piece this together, right? But it is a bigger chunk of change than we've ever seen come through for food through Medicare or Medicaid.
Thank you.
Yeah, unfortunately, like I would just add to that there's no magic scenario right now, but I think we're all really hopeful that this is one avenue that we've been, instead of relying on private grants year after year to kind of sustain these programs, that this is another funding stream that can help, as Sarah said, kind of braid together in this way. Shantae.
Hi.
Hi.
I wanted to ask, is OHA considering that this should not be a reimbursement model, that they should at least put 25% upfront costs available to organizations and even businesses? It just makes it really, really hard. And I had spoken with someone at HealthShare, and they said they were advocating too. And is there anybody at Oregon Health Authority that we could help advocate on the behalf of organizations, nonprofits, and businesses that reimbursement model just does not work? for a lot of us.
Yeah, that's a great question, Shantae, and great consideration. And I think so Julie Reeder is leading the nutrition portion of this, the food and nutrition portion of this, and we've been in pretty regular contact with her. And we being OCFSN VegRx working group, and she's come to a couple of their like learning collaborative meetings. And I think that she's a good person to talk to like advocate for this and really show that this would be a limiting barrier for many, many HRSN providers if we couldn't, come to some sort of compromise on this. And like you said, even if it's 25% upfront, that would help alleviate some of the cash flow and financial burden that the CBOs are carrying, or any, private business even carrying because of that reimbursement model. So that's actually a good segue. I was going to announce that OCFSN, the VegRx working group, is planning on applying for these CCBF funds to hold this learning collaborative space for interested partners. It could be any of you all. It could be other programs that are working in this food and nutrition space that really want to get into the nitty-gritty of how you would even become an HRSN provider and work with other food and food access kind of related folks that are speaking the same language, but are also trying to like translate all of the health system jargon that we're having to navigate through this process, and being a direct, or having bilateral communication between OHA and the CCOs and direct program providers. So yes, I'm happy to put my my information, my email address in here if you're interested. And this is something that we're looking at applying for funds to hire a coordinator, facilitator for that learning collaborative group, but then also have paths through funds that would go to organizations that are wanting to participate, because we also know that it's a burden to show up to meetings on a regular basis and participate and take that time away from your actual direct program work. I know I kind of went off a tangent, and I know we only have a few minutes left. Shantae, did that answer your question?
Yes, I'll probably ping you later if you don't mind sending me their email, and I could follow up with that person, individually.
Absolutely. Yeah. Here's my email address in the chat. Maybe one last question. I see Jack, is this work being connected to, can you explain what BHRN?
Sorry, it's Behavioral Health Resource Network. It's the work coming out of the Measure 110. It's also an OHA funded program. And it basically sets up like behavioral health networks throughout, like each county has one, and it's like recovery houses and like programs and just anyone dealing with substance use disorder, which often is like co-occurring stuff with income and folks who are on Medicaid and things like that. So it just be the folks leading those networks tend to be county or at least in Washington County, it's a county employee, and like this would be really good information for those networks to have. I'm happy to email if you'd like. I can email you at least our contact and maybe some other names if you're interested.
Yeah, thanks, Jack. I would imagine that there's probably some connection there. I don't know specifically. I feel like I've been very focused on the food part of this, but I would imagine with the education and outreach efforts around HRSN that there would probably be a connection with the behavioral health folks at those county levels as well. But Sarah, I don't know if you have any insight there either.
I'm not sure, but I think we can direct you to someone who can answer that easily. I just, one more thing I want to add to answer Shantae's question. So I'm happy to follow up and share more info, Shantae, but I think the way we're setting it up here in the Gorge is that this sort of what they're calling the Housing Nutrition Hub, which will be Bridges to Health. They're like a referral agency that they will actually be managing like the invoicing and processing and payment. So I'm hopeful that Gorge Farmers Collective will get cash upfront. And then the hub lead will be dealing with the deficits and reimbursement. So it's a little clunky and we're like figuring out how to build the plane as we fly it, as we keep saying, but to avoid that like out-of-pocket costs.
Thank you, Sarah. Yeah, we're looking at partnering with a few partners on that as well to help. But there's just so many unknowns with this thing. So thank you for that reminder, though. That does make sense.
Kaylee, there was a question in the chat from Tanya about is there any guidelines or rules around how much food you have to provide for the specific 1680 a week, for example?
Oh, so the intention, let me bring this up. The intention around the fruit and vegetable benefit or prescription benefit is that it should be fresh, frozen, or canned fruits and vegetables and or culinary herbs covering approximately 80% of a member's dietary intake. This is very like relative, right? But it's not like you have to have 10 pounds of fresh fruits and vegetables. It would, you know, if that 1680, and that's per person in the household. So it's, if it's, you know, a family of 4, then that would increase per week. If it is just an individual member, that could be, you know, 2 heads of lettuce and a bunch of radishes. Like I know somebody else put in there some prices, local prices of what that would cost. But the intention is for that to cover about approximately 80% of the members' dietary intake. Is that helpful to answer your question?
Yeah, I think this is Tanya. Thanks. I think that's super helpful. I mean, I think just thinking about when I forget who it was, put the prices of things, just to like kind of get some idea of like what the expectation there, I think is helpful to conceptualize it a little bit. So thank you.
Yeah.
One other nuance I just want to add to that, if you did sign up to provide veggies or medically tailored meals, there's an easy way in this referral system to kind of turn off the referrals if you need to. Say you have a crop failure, or I don't know, you got a cool residency in Baja for the winter, whatever, you can pause for 6 months, which is a really great new component of this this program. So,
or if you've reached capacity, you can only serve 50 families and you're getting more requests, you can say, sorry, we're at capacity and we can't serve anyone else at this time. Yeah. It's a super complicated, we've got a really complicated healthcare system, y'all, as you all know, I'm sure. And it's a lot to dig through. I know it took me months and months and months just to figure out like the difference between Medicaid and Medicare, and like continuing to have those word associations to help myself. Please reach out. Happy to like sit down and break it down even more. Or if I don't have, you know, the answers, I'm happy to connect you to folks that I think might have the answers. They might not also have the answers, is the problem. So, you know, we're all in this together, learning together. But thank you all so much for all the work that you do to grow food, to aggregate food, to eat yourselves. Like, I just really appreciate your interest in this and all the great questions. And we won't figure it out unless we try to figure it out together. So really, really appreciate your time today.
Kaylee and Sarah, thank you so much. Obviously, this is a hot topic. So I appreciate truly both of you taking the time to dig through the weeds and try and break it down in a way that we can understand. And Sarah, thank you for sort of demonstrating what this can look like in practice in a region. I think that was really helpful. So super appreciate it. I think we could talk about this the whole time, but we also have some other folks here from 10 Rivers Food Web who want to talk about the South Corvallis proposed food hub. And if y'all could introduce yourselves, that'd be helpful. Person, I know you, but I don't know the other folks with you today.
Yep. Hi, I'm Kirsten Miller, and I'm on the 10 Rivers Food Web board, and sitting next to me is Kat Walter, and she is also on the board, and Mark is on the screen, and maybe he can wave, and he'll be talking in a minute. So we're here today to share a little bit of context about this project and to share more specifically about the idea that we have for the food hub and to get your feedback. So a little bit of the context. In December of 2021, Benton County got the end of ARPA funds, $550,000 to identify gaps in the local food and beverage supply system and to start a food hub in South Corvallis. So then, unfortunately, the money sat around for a long time, and just in January of this year, a consulting team was hired to figure out what to do with those dollars. So to do a feasibility study to start, and that report has been released, and now the next step is waiting for, again, the Economic Development Office that received the funds here in Benton County to release a RFP for operator. So there are $495,000 in total left in this pot, and the Economic Development Office will be funding possibly more than one project. So that's really fast. I'm trying to, only give you basic things that are useful. So that's a little bit about kind of the pot of money that has accelerated this project. So back, or kind of now focusing in just on our organization, 10 Rivers Food Web, we're an all volunteer organization. We run 2 events right now that are about moving food and moving soil amendments and the logistics behind that. We have a winter soil amendment sale, and we have a fall, oh my gosh, well, I was going to call it a farmer's market, but you guys all know what a Fill Your Pantry is. So a Fill Your Pantry event. So those are the things that we do well already. And the experience that we have that kind of leads into the possibility of running a small scale wholesale warehouse. Obviously, it's a leap to be having a business, to have a location and a site, but those are kind of the onboard or the on-ramp to this project that we have under our belts. So in addition to kind of the timing of the ARPA dollars, Mark, who will be speaking in a moment, he was inspired last spring by visiting the Viroqua Food Enterprise Center in Wisconsin and their model. So he was already working on this idea. And then once the ARPA dollars got activated again, because they had been sitting around languishing for a while, once this proposal went out and the feasibility study started, then it became clear that we might be able to submit a proposal as an organization. So we've established a team and we've got supporters for this vision, and I'm going to hand it off to Mark to share more about the concept and then to hopefully get some fabulous feedback. Thanks.
Hi, my name is Mark Lutera. I'm the board treasurer for 10 Rivers Food Web. I also coordinate the big soil amendment sale in the winter, bring in 120,000 pounds of amendments. About $55,000 comes in into a 10,000 square foot building and goes out in 2 days. So it's fun. It takes a big coordinated volunteer effort. In terms of Food Hub, yes, we're an organization that has expertise in pre-order sales and bringing people together, distributing large amounts. We do it in 2 annual events. We've heard from our constituents. We just launched a local food directory. We've done a number of surveys. Our farmers would like aggregation, distribution. They would like alternatives to the existing wholesale sort of landscape. They would like cold, frozen, ambient storage. Our local restaurants would like to be able to buy local food, but they don't have the capacity to negotiate contracts, negotiate with all of the local farms and coordinate deliveries. They'd like to have a one-stop shop to some extent as well the local school districts and universities. So our community is telling us that they would like a wholesale hub for local foods. I'm also excited about the prospect of wholesale to the public, especially lower income populations, bulk purchasing to make local food more affordable. And yeah, so the vision has come together. The community has told us what they want. Now we just need to make it a reality. Thankfully, there is a suitable warehouse space available in South Corvallis at the moment that nobody seems to be jumping on. So that may not be available forever, but it's available for now. And so we're working on financial models and final outreach to potential buyers to try to pin down numbers and make sure that what we have is viable. And then we'll see if we can get the money, but we're here just to seek input from experienced food hub operators. So I guess that's all I'll say for now.
So I think what would be helpful is you have a room full of folks who, I think almost everyone on this call who is still on this call moves food around, buys and sells food, is operating online marketplaces or pop-up marketplaces, is aggregating food in some way, shape, or form. So you have access to a bunch of folks who are doing that. What questions would you ask them?
I'd start with with what we've shared so far, which is obviously very broad strokes. What concerns you? What have you tried that's similar that gives you pause?
Kathleen Dixon here. I'm down on the coast. My first question is, does that warehouse have sufficient cold storage? Because if you're going to start doing wholesale aggregating, you're going to need large walk-in coolers. So that would be one thing that would make or break that sale or that lease.
Oh, yes, it does not, but that's what the $495,000 are for in part. Yes.
I would recommend maybe just trying to hone rather than try to do a lot of things. My general advice is rather than try to do a lot of things poorly, do 1 or 2 things well. You have outlined sort of wholesale, retail, events. That's a lot. And so maybe, I know that you've already got the event thing going. Just maybe trying to get it take a bite off a smaller piece. But I think Sydney's asking you to ask us because what you are asking us is very large. And so are there specific, are you looking at just South Corvallis? Do you want to deliver to Eugene? You just want to work with restaurants? You want to try to get into schools? There's a lot of things that you could ask.
Yeah,
There
like,
are
like
other
Chris,
things. Go ahead.
I was gonna say, like Christy's saying, if you're gonna sell, for instance, to schools or institutions, then that's one price. If you're gonna sell retail, that's another price. You've got to make sure your farmers are making the amount of money they need. If your wholesale price to them isn't enough to keep them going, they're not gonna sell to you. If they can sell everything they grow retail, they're not gonna sell to you. And that makes a big difference. My particular model is online only. I don't have a bricks and mortar, and I sell only to retail. So I give my farmers their asking price, and I adjust accordingly. But that's just one model, and it's not a very huge moneymaker either, but it's what I do. So those are a lot of things. My main thing is you've got to make sure that the price that you're offering farmers is going to keep them afloat. Because it's so easy to start thinking about the people who are food insecure or getting the prices down so that more and more people can afford it. But you've got to have a way to make sure the farmers get enough money and give the buyers a good price, which is grant funding generally. You can't, yeah, otherwise you're going to cut the rug out from under the farmers. So.
Yeah, to go along with what Kathleen and Christy were just saying, so definitely making sure you have those conversations with producers. For number one, how big of a capacity do they have? Do they want to stay small and only sell direct to, or only sell to retail to consumers? Do they have the capacity? And if so, what is their capacity for selling in bulk to institutions and businesses? And then the rates that they need for bulk versus the rates that they want to sell in small batches. And then also, and then going back to what Christy says, for do a couple things really well versus a lot of things poorly, just taking a look at where your capacity lies for appropriate staff or volunteer allocation for different projects. What capacity do you have? And then versus what the capacity is that you want in order for future projects maybe.
I think, and this might be a little bit broad, and you're sort of asking us to ask you specific questions, and we've considered all of these things, and we have talked to farmers about prices. I think that where we're at is that all of you have gone through the process of, maybe some of you were hired on, but have gone through the process of starting a food hub, and we're going from the stage of we have a lot of community excitement, we have people saying they're going to participate. We don't know if we have the building, if they will participate, right? Just the experience of going from the concept to reality, and did that exceed your expectations? Did it grow, or did you find that you really had to push to make it happen?
I think, Mark, what you're hearing from folks is all the ways that they had to push to make it happen. Christy identified, oh, wow, you're looking at a lot of different things and maybe honing in on what's most important today and building as you go, because it is very, very expensive to do all the things and you very quickly run out of cash or personal capacity, whoever's running it. There's only so much capacity in that person that you're hiring. Lindsay pointed out some really important things about, are your farmers, how much do they want to grow? If you're looking at a bunch of farmers that have 5 and 10 acre farms, they may not want to grow much beyond that, because that starts triggering a bunch of systems issues on their end. It's like, oh, a 5 acre farm or a 10 acre farm, I can do this with 3 people on staff, and that's a pretty manageable thing for me to do. If I start producing a lot of wholesale, then I have to bring on more staff, which changes a whole bunch of things for me. That does not make sense for my family, my life, my farm. Kathleen has really pointed out, you really need to understand, what is the price point that your farmers are willing to deliver at? And then what kind of markup can you take on that price point? And then can your end buyer deal with that price point? I can tell you a lot of people have made a lot of mistakes in that specific journey. That price point thing, it's a real thing. So I think you're hearing that, these are the things you need to be looking at and thinking about to get beyond those are the stumbling blocks that all of the people on this call have come across. Carrie's like giving a thumbs up, and Carrie here is both a farmer and a food hub operator. She started her food hub as a for-profit food hub and has just become a nonprofit food hub operator and is still a farmer and an educator. So I think her voice is real loud in this room.
You know what, I think, Sydney, you kind of hit it on the head. Even Mark did say there's the community excitement. I get excited about a whole lot of things in life, but clearly there's the vacuum that my purpose and my passion is, that 30, 40, 50 years. And I'm saying that in the context of, it's good to have the community excited because you need that initial excitement, but you need to make sure that there's a core, it could be 2, 5, 10 core believers behind the concept, because eventually the excitement is going to wane. Okay. I think everybody will agree. The excitement is going to wane, and then you have that core that's going to move it forward. And then the price point from the farm, quote, to the table, or at least to the consumers, is going to be really the key to, can you maintain this for 2 years, 5 years, 10 years in the bigger vision? So go for it. But you have enough history behind you with a lot of the players at the table to say, these are issues that we have walked through at various levels, and kind of take it and utilize it accordingly, so you don't have to be 10 years down the road saying, oh yeah, we made a host of mistakes, when you had 7 years before you to say what you could or what you couldn't do, or how to do it, depending on your demographics and such. But go for it. And I say that because you're going for it. I've been through it and such. But yeah, go for it.
I think it was Christy and then Kathleen on the raised hand.
Thanks. Yeah, I mean, I don't know if you've ever worked with a business advisor through SBDC or your economic development district, but I would just, start a business plan and start crunching some numbers. How many customers do you need a week? How much money do you need to push? A lot of us, the food hub is either a component of a larger organization that does a lot of grant fundraising. Or in my case, it's the only thing I do, and I pay myself $1,500 a month. So, if you are wanting this to be like a big grown-up operation, I would do a business plan and I would crunch a lot of numbers.
Yeah, and I'll tag on there. Like Christy, I'm also a sole proprietor of a for-profit. I do it all myself. So I'm small and I like to keep it that way. One thing that you'll probably run into, retail versus wholesale, is, do the restaurants realize that just because they want lettuce 12 months out of the year, they may not be able to get that 12 months out of the year, because that's not how the farmers grow. That is something that I've heard over and over again. And restaurants don't have the patience to worry about it. And then they'll just go back to Cisco or US Foods or whoever they use right now. And then the other thing is, it's, in my opinion, it's more inclusive if you shoot first for being an aggregator of sorts for the farmers, and using the aggregations to perhaps sell on a retail level versus a wholesale level, or sell to very, very small users, because that way you can pull in a lot of farms that maybe can only give you, 40 pounds of peaches, or, a case of lettuce every week. But you'll have that, and you can then experiment with what the market really will pay and what the market wants, and your farmers will benefit because they'll get to experiment on growing different things and trying different things. that would be a really good way to get started, especially since you say you've already got community buy-in. I'd been doing this at a farmer's market for 10 years before I moved online. And so I had a lot, I had a name and a reputation, and it's still, my business took a dive when I switched platforms. And it took some education to get people back up to the levels they were at. And that's my last comment is, you're going to want to do a lot of educating as far as the values of local food versus processed or agribusiness food in order to make this work on all levels, whether it's retail or wholesale. And that I would make sure you did when you got started. And now I'll shut up.
Have we overwhelmed you guys yet?
No, that's great. I assume we're out of time. I might take some time to reply to a couple of comments in the chat, but because there's someone on the agenda after us, right?
We have until 2:30, and I'm on the agenda after you, and I can communicate through email. So we can take all the way up to 2:30.
Okay. One more raised hand, Carrie Jo.
Yeah, I just wanted to add one of the strategies that has really helped us transition from a competitive environment between producers to more collaborative is to create a season crop planning schedule. So, because a lot of the producers were worried about all having the same thing at the same time. And so we start in January, and we have a virtual meeting, and everybody's sort of ordering their seed and planning for their year. And it's not a finite thing, but it kind of helps direct succession plantings. And, we're several counties wide, so we don't all have the same growing environment. We don't have the same temperatures or pests or problems. And so that kind of works to our advantage. So if a frost or a pest problem comes in and wipes out one farm's lettuce, that we have a backup plan, and to the customer, they have no idea. But it also allows us to support each other as farmers as well. So I just wanted to mention that suggesting that maybe from the start kind of takes some pressure off the producers to about that competitive feeling and transitioning to more collaborative. Like, I can still grow tomatoes and sell tomatoes, but I have a greenhouse and Farm B doesn't have a greenhouse, so we can actually have tomatoes producing and harvesting at different times and still sell everything we have. So just things to think about as you start coordinating with producers.
I'll just respond to Tanya's question. Curious where the community is shopping now and how that's missing the mark. Our impression is that our community is fairly well swimming in retail options. We have multiple farmers markets, we have CSAs, we have the local foods co-op. And so we are not actually really thinking of doing much retail. What people are telling us they're missing is the more of the wholesale connection to local foods, to be able for the restaurants, the school districts, institutional buyers, to be able to access local foods, and for the larger local farms, and we're talking local farms that are doing, several $100,000, several $1 million of sales a year, and are currently selling a lot through wholesale channels. And they would like they tell us that they're being treated rather poorly by their wholesale accounts and just sort of pitted against each other. And so creating a local option that is more producer centered and that keeps the dollars in the community rather than going out and in some cases coming back is the model that we're looking at.
And I would say that, at least speaking for myself, I haven't gotten scared off, because this is just corroborating what we've heard elsewhere, and also other calls that I've joined for the Food Hub Club, and what you all have been talking about all along. So I definitely appreciate hearing it. And I think we're at this point where we have done some work on, I mean, we've definitely done work on the business planning and the financial modeling, and we've done some on the pricing. And I think we've been kind of on the precipice. We've like talked to a few farmers to get like real numbers. And I think Will, sorry, what you were saying is also spot on for I think where we're at right now. Like we need to just figure out who are those core folks and really go deep with them and figure out if we can go from the kind of conceptual, and I think that's what Mark was kind of trying to get at. We've been in this conceptual place and we want to get to the tangible. So if there are any last comments on kind of how you did that dance with producers, because that's what it feels like. There's some like awkwardness and, and some also like, do you want to build that relationship with us, and how do you kind of build that trust? So if any last thoughts there, that would be great.
I can share a little bit. Someone mentioned in the chat, I think, fresh sheets. And that's how we kind of started in our region, of actually Kiara, who jumped off the call, but getting a handle on who was growing what for, what markets. And it was a little challenging because there's some competition or sometimes turfiness there of who's growing what for what restaurant account or whatever, but starting to just get people around the table. I will caution and just say I went really far down this wholesale route. Remember back in the day, Christy, like we had a wholesale group that was part of OCFSN, bus trips down to Fry Family Farms, like really trying to figure out how to scale here in the Gorge. And what I realized the hard way was our cost of land is just not going to allow for wholesale growth at this point. What is working is building direct to consumer markets and then raising money to subsidize food so that farmers can get paid fairly. And, we have wholesale fruit and other things that are industrial, crops that are reliant on exploited labor. But that's not really the system we want to emulate. So I'm happy to share more, but it's been kind of a hard turn away from wholesale markets. And the other thing I would just share is like, I don't know exactly the landscape down there, but there's lots of underused or vacant warehouses or cold storage here where we live. So we rent both Gorge Farmers Collective and Gorge Grown. We rent space at a really subsidized rate from Double Mountain Brewery of all places. But they have, they bought an enormous cold storage on the cheap and they have like endless space. So maybe there's some of those buildings around that aren't super pricey.
All right, you guys. Thanks for sharing, and thanks for sharing your expertise for all of you who shared what you've learned along the way. We'd love to keep track of what you all are doing and reach out anytime.
Thank you. Thank you. Very helpful.
All right. We are at 2:29, so I want to honor everyone's time. There's one last question or one last comment. We've got 1 minute. But other than that, feel free to start making your move. Christy.
Yeah, I put in the chat. I was wondering if the people who had got grants and are buying stuff.
Oh, yeah, sorry. I was in the middle of writing back to you. Do we need to do that conversation before our next meeting, or should we hold the next meeting for a big conversation about all of the equipment that we're looking at? And should I look for some expert advice to talk about things like walk-ins and trucks? I think that's a lot of what we funded of the big pieces of equipment. So you tell me what you want, or do we need to move it along faster?
Supposedly this is supposed to get done by November.
Mm-hmm.
And, I talked to somebody 3 weeks ago, and if I had ordered it then, I would have gotten it at the end of July. So,
gotcha.
And you have to, if I don't have it at the end of July, then my whole general contractor thing that I set up gets pushed off indefinitely. I don't know if he's got more time, You know what I mean? So
Yep.
I don't know how everybody else feels, but I feel a little time pressure with the caveat that I have not yet received my check, so I can't order it until like
Yep. Okay, so there's a bunch of chicken and egg that I need to chase around and figure out who's the chicken and who's the egg and get some answers back to you. Is
yeah,
what I
and
hear.
are
There's the check question.
Are they gonna announce the grants? Like it's been radio silence
So
overnight.
yes, unfortunately Shin has unexpectedly been out for the last several weeks, and Shin is really holding all of that piece of the puzzle. So I will see what I can figure out.
Okay, is Dear
And
still there?
I honestly don't know, because basically once the grants went live, I stopped touching them because I have a lot of relationships with all of you.
Gotcha.
And it would be inappropriate for me to be involved with them.
Gotcha. Okay.
So I don't really know much about them, which sounds really stupid given my role, but
it really
I don't.
does, but I get it. Yeah. Okay.
I was trying to be really thoughtful about not meddling.
So should I reach out to Deidara and not make you do it, or what?
No, this is going to be a universal set of questions. So I will reach out, and at this point, like, it's all been decided, so I can no longer effectively meddle. So I feel perfectly comfortable having those conversations, and then we'll circle back on the equipment conversation as well.
That would be lovely.
Yes.
Okay.
Yes. All right.
Thanks, everybody.
See y'all.
Okay.
Bye. That was a big one.
Yeah.